All right, do you suffer from aches and pains in your joints? A lot of people do. Maybe you have been diagnosed with arthritis. Well, it's not just a disease of old age, and that's just one of the myths out there. Dr. Kristin Logee is a rheumatologist at UConn Health. She joins me now. Good morning to you, and thank you for coming in.
Thanks for having me.
So, what exactly is arthritis?
Arthritis, it depends on the type. There's many different types, and depending on the type, people of any age can really be affected.
Children too?
Absolutely. Children, there's a group of arthritides that we call juvenile arthritis, which includes children and teenagers. And then there's osteoarthritis, which is most common. It's known as degenerative or wear and tear arthritis. And that's the type that develops slowly over a period of years as the cartilage gets worn away and tends to affect the joints that are under more stress, the knees, the hips, and the spine. Another really common and serious type is rheumatoid arthritis, and this can hit anybody at any time.
Really? That's not in the later years as well? It can be any time?
From children up to adulthood, anybody can be affected, and it's very severe. If it's not treated early, it can cause a lot of permanent joint damage and deformity.
And that's actually another misconception, that there is no treatment available, right? There is treatment. I know there are different kinds, and I'm sure there's different kinds of treatment for each type, but definitely seek help from your doctor because there is help out there.
Absolutely. Yeah, it depends on the type of arthritis as far as how we treat it, but with osteoarthritis we use a combination of things to improve the function and reduce the pain, which can include physical therapy, exercise, weight loss, different types of medications, and in the right patient, surgery can be used usually more as a last resort. With rheumatoid arthritis, it's a very different disease, so we treat it very differently, but we have really good medications that can prevent a lot of that long-term joint damage. As long as patients are treated and identified early, that's really the most important thing, is to get them on those medications before the damage actually happens.
Encouraging that there is hope out there. Here's another misconception, and probably obviously it's not true in every type of arthritis, but many believe that if you have arthritis, you can't exercise.
No, actually, exercise is one of the best things that patients with arthritis can do for themselves. It has so many benefits. It reduces pain, it improves their function, it improves their psychological well-being, so we encourage it, absolutely. The important thing is to choose the right kind of exercise and make sure that it's safe. Really, swimming is an excellent exercise that allows for aerobic activity without a lot of stress on the joints, but there's other things if you don't have access to a pool. Cycling, elliptical machines, and walking are all really good things that we encourage people to do.
And it sounds like getting a correct early diagnosis is really key here. So what would be something or a group of symptoms that should send somebody to the doctor saying, is this a discussion I should be having?
Well, the symptoms, particularly for rheumatoid arthritis, would be more sudden onset of pain, swelling, stiffness, warmth around the joints. It usually affects multiple joints and develops quickly over a period of weeks to months, rather than osteoarthritis, which develops more slowly over years. So in that case, if you were developing symptoms like that, I would say certainly be evaluated as soon as possible. But anybody who's suffering from joint pain and feels that it's impacting their quality of life should really be seen and talk to their doctor so that they can get help, because it's out there.
It is out there. And what a great note to end on, Dr. Logee. Thanks so much for coming in. Really appreciate it.
Thank you.
All right, still to come this morning.